Provincial Health Office, Misamis Oriental. Status of Public Health Programs 2021. With 32 DOH programs implemented in the province, the Field Health Services Information Systems, or FHSIS, creates a vivid picture of the health status of the province. Based on the FHSIS data, the top 3 causes for morbidity or disease in 2021 are upper respiratory tract infection, hypertension, and animal bite cases. Top 3 causes for mortality or deaths for 2021 are diseases of the heart, cardiovascular disease, and diabetes mellitus. Top 3 causes for infant morbidity for 2021 are upper respiratory tract infection, skin diseases, and acute lower respiratory infection. Top 3 causes for infant mortality in 2021 are pneumonia, status epilepticus, and prematurity. Maternal and Child Health Program. Recorded total number of deliveries, 11,832. Provision of antenatal care, 100%. This program has received a regional award from the Department of Health after accomplishing 96.59% for facility-based delivery and 95.89% for deliveries attended by skilled birth attendants, each with a target of 90%. Family Planning Program. The contraceptive prevalence rate is the proportion of sexually active women in the reproductive ages of 15 to 49 years old reporting current use of any contraceptive method. The target stated on the National Objectives for Health for CPR is 29%, but the province of Misamis Oriental has sustained an accomplishment above the said target, which is 35.92%. Expanded Program on Immunization. Based on the Philippine Statistics Authority, fully immunized child is defined as infants who received 1 dose of BCG, 3 doses each of oral polio vaccine, diphtheria, pertussis, tetanus, and hepatitis B vaccines, and 1 dose of measles vaccine before reaching 1 year of age. The target cited on the National Objectives for Health for FIC is 95%. However, due to the primary focus on COVID-19 response, the province of Misamis Oriental accomplished 82.09%. COVID-19 vaccine immunization. Herd immunity is received by vaccine recipients with first and second doses. The target in 2021 was at 70%. Now in 2022, it has been adjusted by the Department of Health to 80% of the 795,186 eligible population in the province. Misamis Oriental's accomplishment as of June 18, 2022 is at 74.28% or 590,640 vaccinees. The province's coverage for those who received 1 booster dose is 12.10% or 71,517 vaccinees. As of June 18, 2022, there have been 16 out of 25 LGUs that reached more than 70% coverage for herd immunity, including the A2 category, which are the senior citizens. National Tuberculosis Program. Based on the Department of Health, cure rate is the proportion of the number of smear-positive TB cases who are smear-negative in the last month of treatment and on at least 1 previous occasion. The National Objectives for Health, or NOH target, is 90%, and the province of Misamis Oriental was able to achieve 90.38% for 2021. Treatment success rate is defined as the proportion of cases registered in a given year that successfully completed treatment without bacteriological evidence of failure. The NOH target is 90%. Meanwhile, the province of Misamis Oriental has achieved 92% for 2021. case detection rate is the number of reported cases per 100,000 persons per year divided by the estimated incidence rate per 100,000 per year. The NOH target is 90%. Misamis Oriental achieved 32%. The province of Misamis Oriental has achieved a regional award from the Department of Health, having achieved a cure rate of 90.38%, as well as a regional award for treatment success rate of 92%. Nutrition Program. Quoted from the World Health Organization, stunting is defined as low height for age. Wasting, on the other hand, is defined as low weight for height. Either is a result of chronic or recurrent undernutrition, usually associated with poverty, poor maternal health and nutrition, frequent illness and or inappropriate feeding, and care in early life. The NOH target for stunting is less than 20%. Misamis Oriental achieved 4.4%. The NOH target for wasting is less than 2%, and the province accomplished 0.9%. Adolescent, Youth, and Health Development Program. Number of established teen health centers, 11. Top 5 municipalities with high teenage pregnancies are Hingoo, Opol, Balingasag, Tagoloan, and Alubihid. More activities are in the works in relation to mental health, adolescent, youth, and health development programs. Teenage pregnancy rate is comprised of 10 to 14-year-old pregnant women. NOH target is 4%. Misamis Oriental's accomplishment is 0.78% with the actual number of 45 women. Adolescent birth rate is for pregnant women aged 15 to 19 years old. NOH target is 28%. Misamis Oriental has a very high rate of 49.65% or 2,514 individuals. Environmental sanitation. The NOH target for households with access to safe water is 88%, and Misamis Oriental's accomplishment is 98.74%. The NOH target for households with access to sanitary toilets is 90%, and the province came up with 89.04%. A zero open defecation barangay is a term used to describe communities that have shifted to using toilets instead of open defecation. By the end of 2021, there were 197 out of 424 barangays, or 46.5%, which were declared as ZOD barangays. Municipalities declared as ZOD are only 7 out of 25, or 28%. These are the following municipalities: Villanueva, Lugait, Laguindingan, Naawan, Alubihid, Hasaan, and Binwangan. Out of 219,120 households, waste management of garbage disposal was performed in 147,504 households, which is 67.32%. And industrial establishments, 2,346. Issued with sanitary permits, 2,245 or 95.69%. In 2021, the following were regional awardees for zero open defecation municipalities: Naawan, Hasaan, Binwangan, and Alubihid. In the same year, Laguindingan was the recipient of a national award as the most improved local government unit with environmental health services, or MILES. HIV/AIDS. Since the implementation of this program in the province, 330 cases have been recorded from 1991 to 2021. And in 2021 alone, there were 50 new HIV cases recorded. Mental health program. There are 985 recorded patients in Misamis Oriental. From GBA, 51, Eastern Towns 165, Clajavita 267, Galileo 462, Manluna 121, and new cases in 2021, 81. The NOH target for the prevalence rate of mental disorder is 88 per 100,000 population. Misamis Oriental's rate is 8.32 per 100,000 population. National Voluntary Blood Services Program. Total blood donors, 2,474. Top 5 municipalities, Laguindingan, Villanueva, Lugait, Naawan, and Tagoloan. Laboratory services are being provided by 13 medical technologists from the LGU. With 11 out of 25 licensed laboratory facilities, number of various laboratories performed in the RHUs, 94,985, and in the hospitals, 105,927. Barangay Health Workers Program. During the administration of Governor Bambi Amano, the annual honorarium for the barangay health workers was increased from 2,000 to 2,500 and then again from 2,500 to 3,000 pesos in 2021. There are currently 3,300 accredited BHWs and 2,000 more workers are still for accreditation. Program-based incentive from the Department of Health was given to Laguindingan as third placer in 2021. Oral Health Care Program has 9 hired plantillas for dentists under the PLGU but still has vacancies for additional dentists. The NOH target for orally fit is 5%. Misamis Oriental's accomplishment is 13%. The following are the coverage of provision of basic oral health care in the province. Misamis Oriental has constantly been a regional awardee for best practices. Malaria-Filaria Program. Misamis Oriental has been a malaria-filaria-free province since 2016. Rabies Prevention Program. In 2021, there were 14,634 cases recorded. For Hingog Bay Alliance, 2,052. For Eastern Towns, 4,274. Clajavita, 2,858. Galileo, 4,650. And in Manluna, 800. Rabies incidence rate in Misamis Oriental is 1,502.97 per 100,000 population. Animal bite cases recorded are as follows. From dogs, 11,544 cases. From cats, 2,968 cases. From others, 122 cases. COVID-19 response. In response to the pandemic, Misamis Oriental is the only provincial health office that took the initiative to do swabbing for RT-PCR, to send them to the Department of Health or Northern Mindanao Medical Center for processing of specimens. Due to the fire that razed the Provincial Health Office building, only the partial number of tests are available. Swab tests done in 2021, 1,559. Swab tests done in 2022, 470. Health Promotion and Education. Provides continuous update and feedback mechanism with health education and promotion officers from 25 LGUs and 8 Misamis Oriental provincial hospitals regarding health programs, especially COVID-19 vaccine hesitancy. This is also the primary unit that will facilitate the initiation of implementation of the DOH playbooks. The 7 priority areas and the DOH playbooks contain implementation guidelines that provide local government units with ready-to-use tools to help promote and protect a critical determinant of health and well-being, including social support among the youth. The LGU must start implementation of 2 to 3 other playbooks within 2022 to 2023, particularly entitled The Last Mile Schools, Bakuna Champions, and Juana Biwais. The latter is focused on violence and injury prevention in the household, while the remaining playbooks will be rolled out by 2025. One of these playbooks is the Mental Health Playbook. Training of trainers commenced in October 2021, and the pilot sites are the municipalities of Tagoloan, Villanueva, and Claveria. The following are documentations of some of the many awards that the province of Misamis Oriental has received. Plan of activities from June to December of 2022. Continue universal healthcare orientation for barangay health workers. Commence orientation for geographically isolated disadvantaged areas or indigenous people leaders orientation. Perform orientation on universal healthcare integration for the local chief executives. Healthcare Providers Network orientation and reorientation, primary care facility and primary care provider orientation on the new guidelines, continue appraisal of Annual Operational Plan 2023 and Local Investment Plan for Health 2023 to 2025, consultative meetings for Field Health Services Information Systems, public and private partnerships, and others. Stakeholders meetings for Epidemiological Surveillance Unit, Disaster Risk Reduction and Management in Health, and Health Emergency Management Service. Preparation and submission of the requirements to implement the other DOH playbooks.